In today's episode of the Back in Shape podcast, we're going to be talking about whiplash and more specifically the long-standing issues that can sometimes result, the neck pain, the chronicity that can result after a whiplash. Whiplash itself really is not per se an injury, but really a description of the mode of onset. The injury will be to the bones, the ligaments, the discs, etc. And that is what you have to contend with. But understanding this can be really, really helpful in moving forward. So we know that many of you watching this will have some degree of neck pain as a result of a whiplash injury in the past. And hopefully today's episode will help you understand maybe what's happened immediately after that injury, what the medical teams have maybe been worried about immediately, but then where some of the failings have allowed neck pain to kind of creep in over that period of time after the injury itself. So it's probably helpful to start things out by talking about what is actually happening. And in today's episode, I will be using the spine a little bit for some of the demonstrations, just so you guys can see exactly what I'm going through. So first and foremost, when we have that whiplash, let's make an obvious statement that our head is a large weight on a relatively small stick. And the neck area, even for those of you that are working out, guys and ladies alike, the neck is not something that we particularly work out per se. So it is an area that there's maybe a little bit more weakness than other areas, because even if we are someone that goes to the gym, we don't tend to strengthen this area. And often the traumatic forces at play when we have a car accident, when we have a fall or knock, are quite significant, and they just overwhelm the musculature that supports our neck. Because again, it is a relatively small structure, the cervical spine. It's not a big structure like the lumbar spine down here. And we have a large head on top, which acts as a a big weight on a long stick. And as we go through that whiplash injury, we essentially go from and this could be in reverse, we go fly forwards in that direction, compressing through all of the vertebra and the discs on the front here. And that's where some damage can take place, on the front from compression and on the back from stretch. And then the resultant reaction to that of things flinging backwards. And again, we can get compression injuries to the bones on the back here, and then the stretching through the front of the ligaments and the muscles on the front here. That is fundamentally what is happening when we have that whiplash. And understandably, when there are large forces at play, there may well be a lot of adrenaline, so we might not necessarily be feeling as bad immediately afterwards in our neck as we might do the day after, etc. And one of the major concerns that your medical team will have, maybe it's the ambulance crew that have turned up, etc., is some sort of break. Now, this could be, as we're going forwards, we get the compression fractures on the front of the vertebral bodies, so turning them from squares or rectangles into triangular type structures or trapezoid structures. And that obviously has serious consequences. That's kind of a red flag, and the medical team are looking to establish that very, very quickly. And it's important to understand that alongside that bony damage, there's of course going to be soft tissue damage as well. And then in the reverse direction, we have the propensity for pars fractures, basically the junction between the bone on the front and the back part of the vertebra. It's in this position, and this bit here can kind of fracture away. And as we go back into extension and crunch back in that direction, we can get fracture on the back part of the bone, and that can give rise to things like spondylolisthesis. So the primary concern is that is there any serious instability in the bony structures that support our head? And that is what your medical team are first and foremost going to be looking at. Thankfully, in the overwhelming majority of cases, that's not going to be the case. The bones are intact and they're fine. And you have the x-ray, they see everything's okay, and they're like, bad accident, you might have a little bit of discomfort, etc., but there's no bony damage. The structures are all intact, and you can carry on with your life. You're going to be in pain for a couple of days with the soft tissue injuries, but they will all heal. And that, unfortunately, is where the guidance sometimes or frequently stops. Now, granted, some of you guys watching this will have had a great medical team, and they will have given you all the appropriate guidance afterwards to help you make sure that when you are discharged, you are supported appropriately. Because just like back pain, the adage, it'll just heal itself, you can just crack on with what you're doing and be careful for a couple of days or a couple of weeks, is not appropriate medical advice when there are so many opportunities, as we'll discuss on today's episode, for the process of healing to be interrupted, impaired, and basically stopped, so that this issue that could be resolved nice and quickly becomes a perpetual issue that lasts weeks, months, and sometimes, or in many cases, unfortunately, years into the future. So it's very, very important to know that. And you might also not be feeling particularly sore at that time. You're shaken up, things are shaking, and it's not till the next day that you start to go, oh, guys, I'm really, really sore here. And if they've only looked at the bony structures and not considered the soft tissue damage and giving you guidance for that, you really are going to get in a little bit of trouble, if that's to say. But that's the purpose of this podcast today, to hopefully help you on that latter part. So just because I've got a few notes up here to make sure that we cover things effectively, we really want to drill down into the soft tissue injuries, because it's the soft tissue injuries that are the things that will bother you most. Understand that the anatomy of your neck, you should have a smooth C-shaped curve here. There are some additional nuances that we want to point out, because this will become relevant maybe a little bit later on, is that the holes where these little nerves come out of, unlike other areas of the body when we injure ourselves, inflammation buildup, which inflammation is the process for helping our body heal, is a good thing. But in the confined spaces of our spine, we have these bony tunnels, just like you might have heard us talking about in the lower back. It's the same in the neck too. And these tunnels, we've got our spinal cord running through the central one, and then these little ones on the side, we have the little spinal nerves that come out to the side. And quite often, if you've got neck pain or you've had whiplash, you're going to get some pain in the neck locally. You might get some headaches. You might get pain down into the arm or shoulder region, down into the fingers, some tingling, etc. Altered sensation along the distribution of these nerves, much like sciatica in the lower back. But inflammation building up in this area is what will give rise to the symptoms, because the neck itself, when it's got a nice normal curve to it, those bony tubes are somewhat fixed. Now, if we bend forwards like so, you can often, you might be able to see that the size of those holes, particularly down here, we can see nicely increases. And when we bend backwards, it returns back to normal. When we look up, it gets slightly smaller. So there is some play in that, but there's not a great deal under normal circumstances when we are still. And this is where that buildup of inflammation, typically through the night, and we find we wake up in the morning and we just can't really move our neck at all. So that's something to consider on the one side. But the ligaments are what provide stability to this spine. The ligaments, not the muscles, although the muscles will be talked about. Hey, you've strained the muscles, there's muscle pain, that'll calm down, and muscles heal great. They're really, really well perfused with blood. They've got a great blood supply. They will heal nicely. But the ligaments, on the other hand, they are what allow the neck to function properly. Now, this backward C-shaped curve that we should have through our neck is maintained by the ligaments. The ligaments mean that there is a degree of natural tension through the entirety of the spine, but the neck, as we're looking at it in today's example. And those ligaments mean that when we bend our neck in one way or in another, like so, all of the individual vertebrae unload from one another, or detach from one another, or decouple from one another in the same sort of uniform way. And that happens in all directions. So we have a system of a tense or stiff kind of pole that can move, but has a bit of stiffness to it. And then the muscles act on that and they move it in certain ways, one way or the other. When we have that soft tissue injury, if it's affecting, say, a specific segment, let's say it's the C5-6 segment down here, let's say it's a couple of segments perhaps, and they have been damaged more, and these ligaments on the back here have been ripped a little bit more. When we go to move in any direction, those weak links move a little bit more quickly, a little bit more readily, and other sections don't quite move the same way. Movement will go through whichever area has the most flexibility, the most instability in this case. And these soft tissue injuries lend themselves to allowing those particular areas to move a little bit more. And it's that movement in the early days that can re-aggravate those areas, potentially putting more pressure on the discs, aggravating the disc injury, which will also have occurred at that same segment during the whiplash injury. And we have to think about, when we have those ligament injuries, what are the ligaments trying to do? They're trying to knit back together again. So as you are flung forwards into that position there, the ligaments, the back parts of the disc fibers, so the annulus fibrosus on the back, will all have been stretched, and many of them will have been torn in some degree. And that's not to say a terrible tear, but it will be some degree of tear to decrease the integrity of those particular areas relative to other areas that are not torn quite as much. And now those areas will more readily move compared to their counterparts in segments above and below. But what we would want to do, if we'd sprained our finger and it'd come out to the side here, we'd want to put it back towards that central position, which is so very important, to hold it so that those ligaments can tighten back up and restore integrity to the finger, so that when the muscles act on the finger, it just moves in one direction. It doesn't wobble to the left and right. And there will be a short window after where those ligaments are still damaged freshly, where they will not be able to restore that integrity. And that's where we find, when we're moving around, we feel a little bit of shearing, a little bit of clunking, a little bit of movement, and a little bit of pain associated with that, because the natural decoupling is not taking place at the level of the neck that has been injured most. And we need to remember that a little bit for later on, because we see that the actions that you will then gravitate to on a daily basis, partially because of life and partially because of direction and because of some other nuances, they exacerbate that weakness that is there. Just before we get into that, it's just worth a little tangent. We saw a lot of people in the clinic with the consequences of whiplash over the years. And one of the things that was very common to most of them was that there was some degree of alignment issues in and around the neck. And that is to say that we should have a smooth C-shaped curve, like I mentioned earlier. And that's really important. But a slight loss of that curve is not an issue, and a slight little bit more is normal variations within the human population. But knowing that the curve should be like that, we would see people with completely straight necks, which is 100% elimination of the cervical curve. You might see there's a little bit of wobbliness to the vertebra. They're not quite lined up on top of one another. And then what was more common still, especially in the more severe cases, the long-standing cases, was that the neck was actually bending forwards at a particular hinge point. Hinge points are not good in the spine because those hinge points act as areas for movement to focus through. And what you'd find is so commonly those hinge points were areas which were problematic. There was maybe a disc bulge associated with that segment. It was just recurrent and it just wouldn't heal properly. We couldn't ever get on top of any, or the patient prior to seeing us couldn't get in on top of their symptoms because it kept coming back, because every single day that area was exposed to more load. And the only way you can really understand this is with load-bearing images, and you have to see it on the person. But we'll get into the alignment stuff a little bit more later on. But it was just something worth noting that quite often those long-standing cases, it's difficult to tell because we couldn't say for certain, because you've never seen the patient before they'd had the whiplash, whether their neck was normal before and then the actions that we're going to talk about now had led them to develop the inappropriate alignment, or whether they already had slightly inappropriate alignment and the accident just made it worse. That's something that the jury's out on, because we just don't know, and there's not a way, well, there is a way to know, but we just hadn't had that information, because people don't come in to see you when they don't have any pain. So that's something they come in after the accident rather than before. So let's get on to the two areas or two reasons why the whiplash, or the acute whiplash, without the presence of severe damage, let's say, or even with the presence of severe damage, can be allowed to get so much worse. And the first thing is our lifestyles. Too many of us are on our smartphones. We're looking down like this for minutes, hours on end every day. We sit in the evening, we're in a reclined chair, propped up, chin on chest, watching the TV for hours on end. Maybe not quite hours, maybe 30 minutes, but have an honest evaluation yourself. How long do you spend in that sort of position, looking down at your smartphone, reading books, working on reports at your desk, etc.? It's probably quite a bit. And going back to the clinic days that I mentioned a moment ago, one of the things that we used to do clinically was remodeling work. And to get a change in the spinal alignment, that is, improve the rate of neck curve, so get it from a reduced neck curve to an increased neck curve in a healthy neck with no damage. So that means that the ligaments are going to respond normally. They're not going to change quicker, perhaps, than you'd like them to in certain areas. It would take around about 3 to 4 months of doing a stretch for 20 minutes a day. Now think about that. So if you've just injured the structures on the back of your neck and you're doing this for more than 20 minutes a day, there is a good rationale to suggest that you might be creating some degree of adaptive change and helping that along on a day-in, day-out basis without even being aware of it. And why do we do this? It comes back to those holes that we mentioned earlier. When you have that inflammation slowly building up in and around the cervical spine where those bony tubes are, the only way you can make the tube larger, we can either reduce inflammation, and that could be using ice, etc., but people will often gravitate to heat because it feels nice, which is incorrect. But they will gravitate to a movement that can enlarge that hole. And therefore, these chin to chest movements feel good, so we do more of them. But what they're doing, let's suppose we've got a disc bulge associated with that segment, is you're continuing to drive down on the front portion of the disc, driving the material into the central disc material into the damaged annulus fibrosis layers, and further stretching and deforming those layers for extended periods of time in a way similar to remodeling that we've just discussed. 20 minutes a day over 3 to 4 months can improve and change the rate of curve in the neck by about 25%. We're doing that at an area where the integrity, the resistance to that change is even less because that section is injured. So if we go back to that C5-6 example down here, if this ligament, the ligaments between here and here, are damaged, as we put ourselves into that position, they will more readily be stretched out than a comprehensive and intact set of interspinal ligaments. And the same goes by extension for the disc fibers on the back part of the disc deep in here. As we are focusing that flexion through that hinge point that might be there. We are furthering the ability of our spine to remodel in an unfavorable manner. And on top of that, it feels nice to look down towards our chest because we're making those holes larger. But unbeknownst to us, we're slowly making things worse and worse and worse and worse and worse as a consequence. And then that brings us to number two. So not only in your day-to-day life, you're doing the incorrect things because they kind of feel a little bit better and life just is set up that way. You're probably doing those things before. You probably still, even without having a whiplash, would, in the evening we're sat watching TV, we might be in this sort of position, flexed neck. My neck is certainly not in a good posture when I'm in that position. We would adopt those. It's just after the injury, we continue to adopt them and they feel nice because sitting upright is difficult. It's difficult because there's load on our neck and it's difficult because our neck's maybe not aligned quite as well and there's inflammation in there. So we want to forward bend. And then we gravitate to the exercises that we might choose. We'll go online, we maybe see some people and they say, hey, look, you've got muscle spasm on the back here. You've got some degree of inflammation, etc. Do these chin tuck exercises like so. Do these stretches, chin to chest stretches that further are supposed to alleviate the pain on the back because there's muscle spasm, but there's muscle spasm because there's an injury there and you're getting signals coming out from the vertebra, just like we talk about all the time with lower back. You're getting signals to those muscles to tell them to tighten up. But by you stretching, you're just reinforcing the original injury that took place. You're reinforcing what you're doing on a daily basis, and you're doing absolutely nothing to help those tissues knit back together. It's akin, going back to that finger example, to pulling the finger out to the side. It originally buckled to the left-hand side, like so, when you had the injury. So you've ruptured all these ligaments on the side here that maintain and hold the finger square. And then your exercises are to pull the finger that way repeatedly. Your daily practice involves pulling the finger that way repeatedly. You can see, is this finger ever going to really recover without having a great degree of laxity to it? And then that laxity means that every activity you're doing on a daily basis is going to be exploiting that wobbliness, as we mentioned earlier. The neck requires that uniform, the spine, that uniform tension throughout its entirety, so that all of the vertebrae together can decouple and recouple with their movement in a uniform manner. Any area that has extra movement compared to its surrounding peers will adopt that movement, will use that movement more. And often that's where, as we mentioned earlier, that shearing and those erroneous movements start to take place. So those are that's kind of how we get caught out. And we gravitate to those exercises. They feel good at the time. Then we find we need to do them again. And we just more and more and more over the course of time. And that is what ultimately leads to the neck pain becoming chronic after one of these whiplash injuries. So hopefully that bit makes sense. I think we'll round today's episode off with sort of 5 little things to help you guys understand how to move forwards if you do have whiplash. At the end of the day, we maybe painted a bit of a bleak picture. Great news is perhaps you don't have any bony damage, but you've got the ligament damage and you've been doing the wrong things. Understanding what the wrong things are is so very, very important. And if we start out with the first tip, you need to understand your own anatomy. Understand how the neck works. We've got our posture, which is our head over our shoulders, which is important for vertical alignment. The further forwards or to the side or to the back our head goes relative to our torso, out of alignment from a postural level, the more forces are going to be exerted on the spine. The spine's fundamental role is to bear load. And if it is injured, asking it to bear more load is going to be unhelpful. So we want to have a good posture. Then we think about the alignment. The alignment is the vertebral alignment that I discussed with the clinical example earlier on. And to that, we kind of need to understand that from an imaging level, and we want to understand what is our specific alignment. Is it normal, or do we have any of those other issues? Now that requires a little bit further investigation and referral for imaging, etc. But chances are, when you had the initial injury, there was some imaging done. You might even be able to pick up those images and go, is my neck normal alignment-wise, or is there something going on there? And those two can be married up to get a real understanding of your neck. But assume for intensive purposes going forwards that your neck does have normal alignment, because it's normal to have normal alignment. So chances are you do have normal alignment. You're not one of the more severe variations where we have some of those issues that we've mentioned with regards to the neck bending the wrong way earlier on. So that's the first thing. The second thing is avoid making it worse. And that involves the academic distinction between an activity, or between the pain in my neck and the injury in my neck. Actions that might well make the pain feel better could include taking a warm shower, having heat on the back of the neck. It could include tucking the chin to the chest. It could include propping your neck up at night when you sleep. All of those things are making your neck injury worse, but they make the neck feel good. Drinking a lot of alcohol might make the neck pain go away. Taking painkillers might make the neck pain go away, but it's not helping the injury. So you want to avoid doing activities that make the injury worse. That is your primary concern. And understanding, hopefully, as this podcast has given you, or this episode has given you, understanding your neck will help you better understand those things. It comes down specifically to posture. And then while we have those instabilities, rapid movements of the neck while things are recovering are not going to be helpful for you. Excessive movements in one direction or the other are not going to be helpful. You want to slowly feed in little bits of movement. And then at the right time, as things start to heal, you do need to restore appropriate and normal movement to the neck. But it's about timing. And often again, we take those extreme movements, left, right, up, down, side, particularly down, more down, as we've discussed today. And we just pummel our neck with those movements way too early. And that's something maybe for another podcast. Number 3 is that we need to unload the spine where we can. And for that, our favorite exercise, so we did a podcast a while ago about the best stretch for your lower back. It's the same sort of principle in the neck. Why? Because using the towel exercise to support the natural alignment in your neck. So that's taking a rolled up towel and lying on your back with it just supporting the natural alignment. Not forcing extension, but supporting the natural alignment is the best way to unload your spine. Why? Hear me out. Number 1, it takes pressure off the whole spine, which is obviously going to be helpful. Number 2, it supports the neutral, natural alignment. Think of splinting the joint that we mentioned earlier. You can splint it in its neutral position, so all of the ligaments are at their neutral lengths, so they can heal at the right lengths and restore some integrity. And we do that regularly during the day, and especially in the short periods after the initial injury. It really, really can help things set in the best possible position. But also, it's taking the ligaments on the back off stretch, it's taking the muscles on the back off stretch, and it's putting the appropriate stretch, because you're neutral, through the structures on the front. So the whole thing can restore and set back in its nice natural position. And doing that periodically through the day, a couple of times, can really, really help punctuate a day that often is full of increased load, looking down, etc. Granted, you've got to cut those things out and make changes there, but this is a great stretch that you can do that can really, really help. Fundamentally, it's the archetypal opposite of the mode of onset of injury and the things that you are doing on a daily basis that make the neck worse. It's supporting the neck. And it's not quite the opposite fully to the chin to chest exercises, because you're not looking up to the ceiling. We're not doing full extension. We're just supporting neutral. But some people, sometimes when they see the towel exercise, the towel stretch for the neck, they conflate it with extension. And supporting a neutral backward bending curve is not extension. Extension is extension from the neutral, or flexion from the neutral. It is not a case of, if we have a straight line and this is the front and this is the back, flexion would be that direction and extension would be that direction. If the line at neutral is, however, in this position, flexion now is a relative straightening of the curve, and extension is a relative increase of the curve. We have to think about the relative extensional flexion from the neutral, and the towel is an exercise that puts you in neutral, not extension, because extreme extension in those early days is also going to be problematic, because there will be damage to the front part of the neck. The issue is that the front part of the neck often is the bit that gets tightened up because you do all those exercises. So if there was any damage to the front, that itself is going to contract and shorten, making it even more difficult to actually go back up. And that's maybe extra detail for another time as well. Number 4, we want to do some progressive strengthening work. As I might have mentioned earlier on in the podcast, I forget, it does seem as though the consequences of whiplash tend to affect women about 2 to 3 times more than men. And that fundamentally is just a case of neck musculature. They've generally got the same sort of anatomy, head size, neck size, roughly, but there's just a significant drop or difference or disparity in the neck musculature. But the forces of a car accident are indiscriminate to whether you're a man or a woman. It still affects you the same. And that lack of strength is going to be vital in rebuilding the strength and support of your neck and providing protection in the interim. Because as we get on to the 5th point, healing takes time. Healing of the muscles and those other areas that have good supply of blood, even our skin, happens relatively quickly. Those tissues are really great at healing, but the ligaments take a lot of time. And you must be doing your strengthening, point 4, in a progressive manner over the long term, so that you can provide a degree of protection for those ligaments while they're going through the healing, point 5, over an extended period of time. One of the things that really catches people out is they do their exercises, they start feeling better, and then a relapse happens. Why? Because they stop doing the rehab work, they stop being a little bit more conscientious about their movement when the pain goes away. Much of the pain that you will experience in a delayed manner will be the aggravation of the tissues and the inflammation that builds up in those confined holes. The ligaments take time to rebuild a degree of strength. They take a significant amount of time, and often that time is still occurring, or that change is still occurring long after you are no longer in pain. So you just have to be careful over the short term and or over the medium term, and slowly reincorporate some of these movements. And that's where some sensible stretching movements and range of motion movements can start to creep in alongside the strengthening. So we do some relief-based work to relieve strain on the tissues, not just the neck pain itself. So we've discussed that already. Then we're doing some strengthening work to rebuild a degree of strength in and around the neck to support and protect that area and start to expose it to a little bit of load so that it can start to rebuild and guide that healing process. And then we add in some movement-based work to start to feed back in some of the normal ranges of motion. But while we think about the normal ranges of motion, have an honest evaluation. You need to feed in movements that you're not doing on a daily basis. That might be rotations left and right. It might be side bends left and right. But almost certainly there is very little reason, I would argue, and you can do the evaluation yourself, for you to excessively or for you to consider the need to add in forward bending movements of the neck. Most of you are already doing plenty of that because you've got one of these every single day. Maybe you're even watching this like so on your phone. Think about the need for additional movements to be added in when we're going through that healing process in the back end. And that will help guide you to the right sort of actions. And you'll probably find that you don't need to add in any more flexion, certainly for a long time after you've injured and after you start feeling better. That will come in through your daily life, and you want to try and limit it to a degree so that it's not too one-sided in terms of the movements that you do on a daily basis. So that pretty much wraps it up for today's episode of the Whiplash podcast. If you've got any specific questions about Whiplash, we've got those comment sections when you're watching this. You can post in the comments. Ask anything in particular. There's a wide range in injuries that can be sustained, or injuries that can be sustained from Whiplash in varying in severity. But ultimately, how we manage those injuries is kind of the same the whole way through. It's just the degree to which we must be focused. So if there's any questions, any uncertainty, post those in the comments. We read and reply to all of those, and that helps us guide you guys more on these podcasts. If you did find it helpful, give it a thumbs up. If you know someone else that's struggling with Whiplash, maybe they've constantly had neck pain since that accident or since that fall or whatever it may be, then consider sharing this episode with them. I know there's a lot of information, but there's tons more support and help on the website as well as with the release of the new neck program. So if you're not quite sure what you need to do, yes, we've got this podcast. Hopefully it's been really, really helpful for you. But if you want a specific step-by-step instruction, then you can check out the neck pain program, which will help you, following some of the principles we've discussed, fix that neck pain and start doing more of the right things. If you do find it helpful, give us a thumbs up, consider subscribing to the channel, and we will see you in the next episode of the Back in Shape podcast. Thanks for watching.